high-level United Nations mission headed by Mr. Abdoulaye Mardiye, Assistant Secretary General of the UN, Director UNDP Regional Bureau for Africa and Chair, United Nations Development Group for Africa, visited Asmara from 15 to 17 December. The delegation was made up of 6 regional directors from UNDP, UNICEF, ILO, WFP, UNFPA and IOM, as well as technical team that came to support the mission. The delegation met with United Nations staff members to discuss staff-related issues such as general working conditions, as well as international deployment as civil servants. The delegation met with His Excellency Mr. Yamane Gabraab, Head of Political Affairs of BFDJ, and His Excellency Mr. Yamane Gabramaskal, Director of the President's Office. The meeting highlighted issues related to international development cooperation. Further cooperation between the United Nations systems in Eritrea and the government of the state of Eritrea was discussed, with fruitful outcomes in expansion of development work, as well as creating conducive conditions for smooth program cooperation. The delegation met with His Excellency, the President of the State of Eritrea, Mr. Isaias Afewerki. In the meeting, Mr. Mar affirmed that along with Eritrea's self-reliance principle, the United Nations will further partner with Eritrea to accelerate Millennium Development Goals achievement and share Eritrea's achievement with the world.
Thank you, Excellency, for extending an invitation to the United Nations delegation. And thank you also for the warm hospitality that we have received from the government of Eritrea and indeed from the people of Eritrea.
The delegation relayed the great support rendered by the Minister for Development Programs in Eritrea. The Minister asserted that no nation can achieve sustainable development in the absence of safe neighborhood and cooperative regional environment. The Ministry of National Development, being the coordinator of the development program in Eritrea, was commended for the progress Eritrea made towards the national and international development goals, including Millennium Development Goals 4 and 5. Eritrea is one of the 4 countries in Africa on track to achieve MDG 4 of reducing child mortality, maternal and neonatal tetanus elimination, malaria elimination, and HIV and AIDS. Eritrea is polio-free since 2005. Eritrea has also made good progress in meeting MDG target of safe drinking water, with marked improvement in drinking water supply coverage in both rural and urban areas. Eritrean government was encouraged to share latest data, success stories, and best practices. At the Development Partners meeting, attended by Asmara-based donors from 22 countries, the donors assured to renew partnership and collaboration with the United Nations system in Eritrea. Christine Ann Umutoni, resident and humanitarian coordinator, noted that the UN systems in Eritrea is moving towards sustainable development and the value for money is evident. In Eritrea, she noted, you invest a little but harvest a lot. Ms. Christine Ann Umutoni opened the dinner hosted by the UNCT at Hedmona Traditional Restaurant, which reflected the friendly Eritrean hospitality and tradition. In his remarks, Mr. Mar noted that the mission so far has been very successful, and as a delegation we have given our commitment to the government that the UN in Eritrea will ensure that it continues to produce results and create impact, he added. The delegation left Asmara on Tuesday morning to visit UN project sites in Dabub and Ma'kal regions. The nutrition site in Dbarwa Health Center was the first stop for the team. The program, supported by UNICEF, provides community and facility-based supplementary and therapeutic feeding for children under 5 and mothers. Upon arrival in Mandafara, the administrator of Zoba Dabub welcomed the team to the region and gave an overview of Zoba Dabub.
We are very happy
The second stopover for the team was the Mandafara Hospital to visit the National Fistula Referral Hospital supported by UNFPA. This year only, 88 patients were admitted to the site with 99% success rate, said Dr. Habte Hailemalakot, obstetric, gynecologist and fistula repair specialist.
We are keeping them here until we are sure that she is cured.
The hospital has recently built a hostel that caters for patients from within and outside Mandafara. The fully furnished hostel provides patients with the facilities to lead their day-to-day life until they are released from the facility. Mandafara Hospital also utilizes a high-tech gene expert machine supported by WHO. The machine accelerates diagnosis of drug-resistant TB, which normally takes about 2 weeks to identify. The results from the gene expert machine are now obtained within 2 hours once the TB diagnostic test is administered. The HIV and PMTCT projects led by UNAIDS provides counseling, ARV, care and support to HIV patients in Zobadebub. Among other things, the patients are given nutritional advice and care on positive living with HIV and AIDS. Prevention of mother-to-child transmission is a major component of the National HIV and AIDS program, according to Sister Negisti Tesfa Mikael. The third stop for the team was Marhano Temperate Fruit Site, supported by FAO. FAO procured 101,000 seeds, out of which 30,000 were grafted and distributed nationwide. Peach, apple, olive, and pear were among the fruits distributed to various sites in Eritrea. The next stop, at the Lamza Micro Dam, supported by UNDP, is the major source of water for vegetation in the village. The community supports itself through sales from 27 vegetables grown in the farm. The community-based project is coordinated and led by the Kababi administrator, Ms. Abrahatzian Fsahaye.
The microdam solved water-related problems in the community and changed many lives. We also thank UNDP and the Eritrean government for supporting the microdam that has alleviated economic problems in our village.
The last stop was the UNICEF-supported solar-powered water project, which runs water supply for 17 water points in the Marhano and Adika community. The water site extends up to 18 kilometers to provide water to the community, schools, and health facility. At the end of the field mission, Ms. Umotoni, in her remarks to the national media, said, "The field mission gave the delegates an insight into the actual project implementation and the impact it had on people's lives. They were able to witness the Eritrean hospitality." She continued, "What is required in Eritrea is now to scale up projects." The delegates also commended agencies for their achievements and the government of the state of Eritrea for their commitment and leadership to inculcate self-reliance in its society. Mr. Marr, in his concluding remarks to the national media, said, "Our meetings with the President and senior government officials at national and subnational level were fruitful. We discussed how best the UN system can strengthen its support to the country's sustainable development agenda," said Mr. Abdullahi Mardie, Assistant Secretary General, Director UNDP Regional Bureau for Africa and Chair, United Nations Development Group for Africa.
The result of this meeting will be that we, the regional directors, will help the UN country team mobilize more resources for the development of Eritrea. And then we have seen that Eritrea has a lot of good stories to tell. Eritrea is one of those countries that have been doing very well in the Millennium Development Goals related to health.
and we think that this story is to be told. And in the mining sector, Eritrea is a country that is doing very well in terms of the mining code, and this is a lessons that can be shared with other African countries. So when we came here, we saw that Eritrea has a lot of stories to tell, and we, the UN, will be happy to be a partner in telling those stories. Thank you very much.